Hello, my name is Gabrielle Glantz, and this is my second article critique for Professor Cameron Mount. And the article that I chose is The Behavioral Change Wheel, a new method of characterizing and designing behavioral change interventions by Michi. The purpose of this article is to introduce the BCW model, or the Behavioral Change Wheel. So this is a framework that is designed and implemented to better the understanding of behavioral change interventions and to personalize the understanding of behavioral change interventions. So Michi did the premise of his research around creating the BCW as a way to identify which behavioral change interventions should be applied to patients, and using determining factors like their health, their environment, their education, and etc. So really tailoring the intervention to the specific patient. And then ultimately hoping that because the intervention is tailored to their environment, their circumstance, that it will promote behavioral change. Throughout this article, Michi had some great key findings. So for the behavioral change wheel, he is implying that this wheel should be used to address determinants of behavioral change. So for example, the three overarching elements that he used in the behavioral change wheel is capability, opportunity, and motivation. So he also breaks all three of these elements down so they can be understand and they can help tailor behavioral change interventions to the patients. So for example, with capability, he said look at it from a psychological or a physical capability, so what the person is capable of. For opportunity, he states that we should look at outside determinants, so their environment, the things that they're located near, or things that could affect them from the outside. And then also for motivation, then this is where the autonomy comes in, and the person we should be identifying how do they respond emotionally to different interventions, so we can better pick which intervention would promote behavioral change in our patients. Through this article, I think Michi did a great job of including other behavioral change theories into his article and frameworks that he explored during this process. And I think he also did a great job at designing this intervention, or implying that this intervention can be used as a basis for creating different frameworks. He did a great job at explaining that this is crucial to behavioral change because the outside determinants ultimately fosters how the person responds to different interventions. I would personally use this model in my profession as a health coach once I receive my master's as well, because I do feel like this would be a great basis to creating additional frameworks and also ensuring that I am using every patient as their own, or tailoring every intervention to that specific patient. So I'm looking at their journey or their process from a holistic view, and not just honing in on this intervention will work for smoking cessation, or this intervention will work for obesity, but actually tailoring the intervention to the person and their circumstances or their other social determinants. Overall, I think Michi did a great job at discussing how the BCW framework can be applied in real world. It can be a basis for creating new interventions, and then also using the current interventions that we have and tailoring them to our patients to promote behavioral change and ultimately address their social determinants as well. But still, like a lot of other articles that we have read, and a lot of other articles that I have seen, it still needs additional research and additional validation to ensure that these methods work for our patients. But overall, I would use this method and this framework when applying interventions, and also if I choose to create my own. So I think you did a great job.